Hi, I'm Vidya Raj. I'm an international patient ambassador. I advocate for people with chronic illness, limitations, and disabilities. And I want to tell you that if you are a doctor, a nurse, maybe you're a student nurse, or you're thinking about medical school, there is one way to ensure that you join the ranks of the best of the best. I'm talking the best doctor, the best nurse, the best healthcare provider. The one thing is to listen. That is all that you have to do. If you go into any patient support forum, you will see it repeated over and over again that someone waited a long period of time, saved up money, went to the doctor, and wasn't heard. I saw a post recently by a doctor saying, ask me questions in the appointment instead of going home and Googling it. And my response to that doctor was, please advise your colleagues to listen, because patients can ask questions, but if they end up being dismissed, asking those questions doesn't help. It hurts instead, because then they're less likely to voice their concerns. The vast majority of patients don't seek proper medical care in time because of the fact that they will not be heard. I've heard it being said before that if you have an appointment with a specialist, don't bring up everything that you want to. Choose 3 things, because there is a time limit, maybe 15 minutes, maybe half an hour, maybe 10 minutes. And while I understand where people are coming from when they advise this, I also say what we may think of when we prioritize that list could be the answer to solving the problem in diagnostic criteria. So often, patients go unheard, and this is not okay. Women were previously told it's in your head, it's anxiety. In fact, we're still told that. And then years later, sometimes on the autopsy table, the true cause is figured out. And it happens all the time. So, if you're a healthcare professional, before you think to say, lose weight, you're imagining it. It's just anxiety. It's just us getting older. Pause for a moment and think about what that patient is trying to convey. And don't tell them that they're complaining too much. Because if you had to step inside that chronic patient's body for even a second, you would not cope.